creating new intensive care beds in the hospital has actually been much easier than I expected. It's been easier than I expected because the teamwork and the extra effort and the extra work that people have gone just to make the remarkable happen. So we created 18 beds within 4 days, completely stocked, beds, equipment, everything, and it was amazing because we had to have sinks put in, we had to have different methods of ventilation and kind of tweaking with air and oxygen and things, and it just got done. It didn't feel a hard process at all. It actually felt quite a beautiful process that you'd come into a department and see people who I'd never met before, contractors, external, internal people, facilities, estates. Everybody was working really hard to get the beds ready for the patients when we needed them, and it was beautiful and it wasn't hard. I expected it to be really hard and it wasn't hard. So it was a great process. So we've been really lucky. We've had lots of people who volunteered to come forward and to help us in intensive care, and we've had lots of people who've been redeployed to help us. And they've all come in and been keen and enthusiastic and supported. There's been a really good education package for the staff. So we've got 6 clinical educators in our department, and we've gone through pump training and proning and everything that we think this kind of group of staff might need to make sure they're feeling comfortable in the environment. We've done simulation training. And it's, I think everyone has really enjoyed it, and I think it's because we were under quite a lot of pressure. I think everyone has come together as a really lovely team to be able to make it better for the patients, because everyone who works in the NHS is here for the same reasons, which is keeping patients safe and getting patients better. I think it is really hard for patients, and I think that's one of the biggest challenges for our nursing staff, because they are used to providing such a level of support and love for the loved ones of our ICU patients, that not being able to do that in the way that we normally do that is really hard. So we've got lots of schemes. We've got the Send a Card scheme, which is run centrally by the patient experience team. We've also got one of our nurses went out and got an artist to commission a beautiful painted oak tree that she's got everyone to take their fingerprints, take their little fingerprints, as to be kind of part of this oak tree to kind of represent the team and represent the team of people looking after them. So all these cards can be sent out to loved ones with a message from the nurse that's looking after the patient. We've got a knitted heart scheme where we're taking pictures. We're giving a patient a knitted heart that's very kindly been donated from the community. We're taking a picture of the heart in the patient's hand if they're unwell and they're sedated, and sending it to the loved one, and then sending the loved one a knitted heart as well. Not the same knitted heart, so the patient keeps theirs and the loved one has theirs, to try and provide a bond. We've been really lucky. We've had iPads donated to the trust, and we've had Zoom technology, being able to do video conferencing with the patients, which is so important. You see patients who are understandably very anxious and very scared about being in hospital, and being able to see their loved ones. It's really cool when they can speak to their loved ones, but when they can see them, it just transforms everything. So we've been really lucky with being able to kind of support our patients to communicate with their loved ones, because we recognise that's the hardest thing for lots of our patients at the moment. So the Secret Garden started off as a ICU rehab space. So lots of our patients in intensive care need to feel normal, to feel that they have something normal in their life. And so many of them, when you talk to them about what's the thing they're most looking forward to when they get out of hospital, it's going out in their garden, it's drinking a beer in their garden, it's sitting with their loved one, watching the flowers, watching the bees, watching the birds. So we knew that we wanted a way to motivate and to support patients with their ICU recovery, because we know how hard ICU recovery is. So we built this space in an internal light well, and we were really lucky to get Chelsea Flower Show, Tom Massey and E Valley Organic Supplies to be able to supply these beautiful plants. And this has turned into an hour staff and a patient resilience space. So staff come out here and relax and have lunch, but then we also have staff out here. So over the weekend we've had our first patients out, COVID positive patients, out into the garden to feel normal. And I just saw a patient leaving, and he was just so happy, and it was so important, and it's just so lovely to be able to do those little things for patients to make them feel normal. And he FaceTimed his daughter from the garden, and it was beautiful. So just as I came out, somebody had delivered fish and chips for the whole of intensive care. Now, the morale lifting gesture of fish and chips or cakes or beautiful hand products, because our hands are all really, really, really sore with washing hands. And people have been donating creams for noses to make noses kind of feel better. Showering soap, because everyone's showering at work now. It's it's just been beautiful and remarkable and humbling and just so kind and so generous. And I think a lot of us are just so humbled by it. We're just all really humbled by it. So it's just beautiful. So thank you to everyone who's donated, because it's just so kind.